Hello, myself Amit. Uh, in this reflection, we'll be talking about my work using the Savannah and Lewis case study that I chose during the assignment 2. This video will allow me to consider how I was able to form a therapeutic relationship, employ ethical principles, emotional focused therapy, and analyze the effectiveness of my approach as well as the difficulties and way of improvement in future sessions. During my initial sessions, I had made my priority to establish a good and balanced therapeutic relationship with both Savannah and Luis. I tried to be very conscious not to be take sides or be biased, as Savannah was very aggressive and drinking alcohol could have easily made me biased. Rather, I was attentive to the experiences of both partners in terms of empathic and non-judgment. In this case of Louise, I recognize her insecurity, loneliness, and being emotionally disconnected. Simultaneously, I confirmed to Shavana that she experienced work related stress and pressure, and her behavior can be attributed to emotional overwhelm as opposed to deliberated harm. I made sure that partners equally had space to speak and be heard. To facilitate this process, I applied active listening and reflection and open ended questions. When looking back on my practice, I think it was this unbiased and empathic approaches that was able to keep my defensiveness at bay and enable me to provide a secure setting in which both of pattern or both of partners could start to be more open with each other. Ethical considerations were of special relevance in this instance, as there were that aggression and emotional suffering involved. I made it clear at the start of the session that there are confidentiality and limits of confidentiality which are particularly important in case where the harm might occur. It has been noted that balancing confidentiality and client safety can be a challenge to a counselor, and they need to exercise ethical judgment. And I also took informed consent to ensure that both Savannah and Louis were aware of the counseling processes and their rights. Also, I was conscious of my own possible bias, especially when reacting to the aggressive behavior of Savannah. I consciously tried to be non judgment and supportive of the two partners. In my opinion, the use of these ethical principles contributed to building trust and a safe and professional therapeutic settings. In this instance, I choose emotion focused therapy as my mode of counseling. I decided to use the EFT since it is more oriented to emotional experiences and the patterns of interaction in relationship, which are the issue in this case. It has been proposed that a strategy like emotional focus therapy can help improve emotional bonding and minimizing the relationship distress. And also, overall, the effectiveness of couple therapy has been demonstrated to enhance the functioning of a relationship and better conflict management. Due to the lack of emotional contact, conflict, and communication issue between Shavana and Louis, I think that EFT is the most suitable intervention to help this couple. So, my initial action in EFT would be to determine the negative interaction cycle between the couple. Here, aggressive behavior is seen to result in stress and frustration experienced by Savannah, and insecurity and withdrawal by Louis. This trend contributes to opposition and lack of emotional closeness. A study have shown that unresolved stress and emotional problems may lead to conflict and aggression in relationships. So this is the evidence in this case. I would then assist to that partner other partners to realize this cycle and realize how their behavior affect each other. I would then help both to discover and reveal their feelings. As one example, I would assist Savannah in realizing that there are underlying feeling of pressure, fear, or inadequacy, and not out warding them with anger. Likewise, I would help Louise to be more open and vulnerable and talk about her feelings of loneliness and emotional disconnection. I also would help the couple to develop more that empathetic communication where they are requested to listen and reopen to one another emotional that instead of defensively. It is also demonstrated that exposure to aggressive behavior may result in emotional distress and insecurity, which contributes to explaining the experience of Lewis and emphasize the need to consider emotional safety in the relationship. Overall, I would have preferred to restructure their interaction into a more positive and emotionally engaged pattern. In relation to my practice, uh, there are some challenges that I am aware of. The aggressive behavior of Shavana would be one of the most burning points to be managed, yet it would be needed to talk the non-judgmental and compassionate stance. I may have problems trying to strike a balance between supporting her and addressing unhealthy behavior. The other issue can be to ensure that Lois is given an equal voice, especially when she tends to isolate herself in scenario of conflict. I also realize that my own emotional reactions to that's aggression might be one of my blind spots and can possibly affect my uh, neutrality. In addition, uh, I might find it challenging to apply the EFT techniques when the emotional intensity is high, particularly when I am just a flooding practitioner. Uh, to avoid such troubles in the further session, I would train emotional control and professional boundaries. I would use formal techniques such as taking turns and facilitating communication because the patterns are although to be equally involved in the session. To improve my blind spots, I would engage in lifelong supervision and self reflection to become more aware and develop better counseling skill. When it comes to aggression, I would put the safety first and indirectly help Shavana to find a more productive method of expressing emotions. I think that such strategy would assist me to better support both clients more effectively with a balanced and ethical approach. So, summary of this all the session, it means the conclusion. This reflection has emphasized the necessity to develop a good therapeutic relationship, use ethical principles, and choose the right approach to counseling. It has also made me understand the importance of self awareness and constant professional growth in the dealing with challenges and assisting client as well. So I learned the more of the important points here, the how to be manage that blind supports blind sports and to improve my skills. Thank you.